and a member of the California Nurses Association. She was violently assaulted by an inmate while attempting to provide him care. Unable to recover from the injuries she sustained from the assault, she tragically died 3 days later. Her death sparked a public outcry over the safety of RNs and other healthcare workers in correctional settings, spurring our organization to find a way to enact minimum and uniform standards and policies that would ensure the safety and security of healthcare professionals in our jails. I will close by stating that the violence in California healthcare facilities is an endemic problem and one that demands change. In many facilities, there is a culture present in which workers are expected to accept violence as part of the conditions of the job. With this legislation, we want to dispel that culture and make a bold statement that it is time to treat the problem seriously. Thank you for your attention.
Thank you for your testimony. Do we have other supporters? So please state your name.
Tricia Hunter, American Nurses Association, California, in support. We did send a letter, so I'm not sure where it went, but I'll find out.
Thank you.
Ken Murch, I'm representing the California Association of Psychiatric Technicians. Our members work in the state hospitals and developmental centers and prisons. We lost one of our members in a murder last October, Napa State Hospital. It's been recorded that in any given 12-month period, there's as many as 1,400 assaults, either on the staff or fellow patients. Although some of the recommendations in this bill are already implemented by the Department of Mental Health, there's time to step forward and make some improvements. So we're in support of this bill. I just want to say one thing, as we apply to our mental health clients. As we stand here today, there's approximately 6,000 patients in the mental health hospitals. Less than 400 of those are civilly committed. The remainder are committed to the criminal justice system. This is a very, very potentially dangerous place to work. And this bill is just the first step that our organizations and other organizations are taking to bring forth toward the legislature to try to improve the safety in our state hospitals. So we're in support of this bill, and thank you.
Thank you.
I'm Barbara Blake. I'm the State Secretary with United Nurses Associations of California. I wish that I didn't have to be here today to ask your support of this bill, but we are experiencing more and more violence against the staff and other patients in the hospitals, not just the behavioral health centers.
Excuse me, just your name, please. And
Barbara, I'm Barbara Blake.
Are you in support of the bill?
I'm in support.
Okay, thank you. Next. Anyone else in support of the bill? Opposition?
Good afternoon,
can you make room
Mr.
for the
Chair
opposition, please? Thank you.
Good afternoon, Mr. Chair and members. Thank you so much. My name is Debbie Rogers. I'm here on behalf of the California Hospital Association. We're opposed to this bill not because we think that the programs that are in place to prevent violence and some of the provisions of the bill are necessarily bad, but what this bill does is it creates additional entities to provide oversight to the same issues inside hospitals. For example, the provision of the bill that deals with how we would respond if an employee is hurt or suffers violence on the job. That's already regulated by Cal OSHA. So there are many parts of the bill that really add additional layers that we don't feel are going to help prevent violence in emergency departments. We'd like to thank the author for taking on this really complex issue. We understand that there have been some tragic events, most notably the two that you spoke about in a mental health hospital and in a correctional facility, which are not under the same requirements of general acute care hospitals and aren't required to follow that area of the law. With me here today, I have Vicki Sweet, who is an emergency department manager, to talk about some of the things that are happening in hospitals.
Good afternoon, Mr. Chair and members. My name is Vicki Sweet. I've been a registered nurse in the emergency department for over 25 years, and as Debbie mentioned, I'm currently manager of a very busy emergency department. A little bit about my history with violence and healthcare legislation. Following a deadly ED shooting in 1990, I presented a resolution at the Emergency Nurses Association annual meeting, which resulted not only in a position statement by that emergency nursing association, but it also resulted in research. The resolution was adopted unanimously, and the research helped us validate the things that we are experiencing in the trenches every day. As our colleagues from California Nursing Association have already told you, violence it's a problem in emergency departments. But I worked with CalENA on the California Hospital Security Act, and I helped them not only get that legislation passed, but to develop statewide education for emergency care providers in California to help mitigate the violence in the workplace. And I am here, as Debbie mentioned, with the California Hospital Association in opposition to this bill. Hospitals do have a responsibility to ensure a safe and healthy environment, not just for staff, but also for patients and visitors. And we take this responsibility very, very seriously. Hospitals and acute psychiatric hospitals already have a mandate to perform annual security and safety assessments, and based on that assessments, they're to develop a plan. They're already required to train staff regularly assigned to the emergency department, and in 2009, AB 1083 by Speaker Perez updated this law to include measures to improve safety of patients, staff, and visitors. As has been mentioned, several administrative departments and organizations already provide oversight to hospitals, including the Department of Public Health. Provisions, the enforcement for the provisions of AB 1083 include the reporting of criminal acts that cause death or serious disability to staff, patients, and visitors. Department of Public Health requires hospitals to develop a patient safety plan that includes a reporting system for patient safety events that allows anyone involved to report any issue regarding patient safety or staff safety to the facility. This plan must include prevention of adverse or criminal events, including death or significant injury. The California Department of Health Patient Safety Licensing Survey also specifically addresses these requirements and includes adverse events reporting, safety plans, not just for patients, but for staff and visitors as well. And they also have the ability to take administrative actions, including fines, if there are identified problems. California Occupational Health and Safety Administration, CalOSHA, and workers' compensation law already provide oversight for worker safety and appropriate care related to work injuries. CalOSHA requires hospitals to keep a log of work-related injuries. I see that my time is up. I do want to just say that while AB 30 is very well intended and very admirable, it creates additional layers of reporting as well as fine and inspection structures for hospitals. And as I mentioned, hospitals have a responsibility to ensure safe and healthy environment for patients, visitors, and staff, and we take this responsibility very, very seriously. Thank you.
Thank you very much. Are there any other witnesses in opposition? Seeing none, we'll move to committee member questions. I just want to thank Vice Chair Logue for chairing in my absence. And we have Member Bonilla with a question. Ms. Bonilla?
It's really not a question, more of a statement. I was serving on the Board of Supervisors in Contra Costa County when the incident occurred just last year with our nurse. And I want to say that there was immediate action on the part of our county sheriffs and hospital administrators, but to correct the situation. But the problem is it still did happen. They learned from it, but still such a tragic occurrence. I think the more awareness that we bring to the issue, the more attention that we give the issue in a very serious and instructive manner is going to result in a safer environment for our nurses.
particularly those who have taken on the very, very challenging assignments within our jails, and that was our situation in Contra Costa County. I think that nurses should stand commended for the fact that they are willing and often deeply committed and passionate about serving the sector of the population that many of the rest of us would be very fearful of encountering. And that goes for all of the employees who are working within these very high-risk environments. And I think it's incumbent upon us to acknowledge that service and then do everything within our power to see that they are protected, that they are safe, and that they have input into this process and that they feel their voices are being heard. And so I want to thank Assemblymember Hayashi for bringing this forward. I think it's a good response, and we don't want to get caught in a situation where we're always reacting to tragic circumstances. And thank you for taking on this issue and helping us really move responsibly forward and really putting the care and the protection, the safety of our nurses and other staff members as a #1 priority.
Thank you. Would you like to be added on as a co-author?
Certainly.
Thank you.
I'd like to call next on Mr. Mansour.
Thank you very much. I appreciate the efforts to improve safety in the workplace. It's always a good thing to try to do that, but it seems to me there's already existing legislation to cover this, and I don't know that there's anything in here that takes into consideration the time, the money, ability of hospitals to implement this new regulation. And I wanted to find out from the hospitals if there's if this will detract from other obligations that the hospital has in terms of providing care, other obligations that you have.
We take the obligation seriously to ensure a safe environment for our patients and their families and our staff. The additional and overlapping reporting requirements will absolutely take time away from other duties. I know that often, as a nurse myself, this often falls at the nurse manager level to ensure that all of the reporting is done, and it likely will take away from some of the time that could be spent on patient care.
Thank you very much.
Could I respond to that? Thank you for the question. I also want to note that the National Emergency Nurses Association did a survey in 2009, and they showed through their survey that 50% of emergency room nurses have experienced violence by patients on the job. And our Speaker Perez did a great bill last year, moving us a little bit closer to prevention. But what this bill does is strengthens existing laws regarding hospital violence plans, violence prevention plans, and it also creates new standards to protect healthcare workers at correctional facilities. And the correctional facility workers are not covered in the Speaker Perez's bill. So I just want to point out that it's not duplicating, it's strengthening, and as we can see, and I think I was really glad Ken was here representing this, the psych technicians, because Donna Gross, who is a psych tech at Napa State Hospital, was strangled to death and was not found for 24 hours in the facility. So clearly, we have a role to play here, and I think we are not doing enough to prevent workplace violence. I don't think the AB 30 is duplicative. I think that it builds up on what great work that John Perez did last year, and it expands the mandate to the correctional facilities, and I respectfully request your support.
Thank you. Did you have a comment on that?
If
we have
I
some
may,
other
Mr.
questions.
Chair, with your permission, Kelly Green with the California Nurses Association, and I just want to make clear about the assertions that the reporting requirement is overlapping with existing laws. We disagree with that. The adverse event reporting law that the CHA is citing applies specifically to assaults that result in death or significant harm, which is not defined in law, by the way. It does not expand to the types of routine assault and batteries that the nurses and healthcare workers are experiencing in hospitals. The same for Cal OSHA as well. The reporting requirement is triggered when a death occurs. So we do not think what we're doing with this bill is duplicative of those laws. We think that it enhances, and it would be an entirely separate reporting.
Thank you for that clarification. I have Member Williams with a question, then Mr. Amiano.
Well, I just wanted to thank the author and inform her that you had a very good person asking for me to vote for this, which was my mother, who works in Atascadero State as a teacher. So it's not just, obviously, nurses are on the front line, but there are many other professionals, and their safety would also be enhanced by the safety of health professionals.
Thank you.
Thank you, Mr. Williams. Mr. Amiano?
Yes, I'm very supportive of this, and I thank you, Ms. Hayashi. I just had a clarifying question for Mr. Murch. Did Mr. Blakesley last year have a bill around security? Did that get vetoed?
Yes, it wasn't around security. It was regarding gassing, penalties on gassing. Mr. Blakesley is working with a coalition of unions right now on another bill relative to hospital safety.
Thank you. Mr. Hernandez.
Thank you, Mr. Chairman. Again, just want to congratulate Ms. Hayashi. I think it's a bill that needs to be present today. Formerly, I served on a city council, and we had a regional hospital in our area. And I can tell you, the people that are involved and are exposed to danger, while the nurses are a big part of that community that's exposed, also members of law enforcement and other patients as well. And I understand the concerns that are brought forward by the California Hospital Association, but I will tell you, long term, you're probably saving money by bringing forth this mitigation and better preparedness, because just in the litigation alone that we faced as a city, and I can only imagine that the hospital was facing, and just responding to the claims that were brought forth by those that were involved. There was actually a death involved here in this scenario that we dealt with behind closed doors. I was left with one thing, and that was hospitals need to be safer for both the nurses and the patients and those that are coming to visit their loved ones. This is it's very serious. And Mr. Murch, thank you for your comments as you added for the many of those that are visiting our hospitals and are required to stay. They're not always there because of an accident or a health or age-related health condition. Many times it's a disability, and it's a dangerous disability that causes danger to others. And when you noted a very small percentage are there admitted civilly, we do have to make sure that we're very thoughtful to that reality that our nurses are working with each and every day. So I look forward to supporting this bill today.
Thank you very much.
Thank you. I'd entertain a motion.
Second.
I had a motion from Ms. Lowenthal, a second from Mr. Amiano. I heard some others, but those are the ones that will go on the record. And this is a due pass and refer to appropriations. Ms. Hayashi, would you like to close?
Thank you, Mr. Chair and members, and thank you very much for all your comments and recognizing that this bill is very much needed to protect workers in our state, and I respectfully ask for an aye vote today. Thank you.
Thank you. Clerk will call the roll.
Monning.
Aye.
Monning, aye. Logue. No. Logue, no. Amiano. Aye. Amiano, aye. Atkins. Aye. Atkins, aye. Bonilla. Aye. Bonilla, aye. Eng. Aye. Eng, aye. Garrick. Gordon. Aye. Gordon, aye. Hayashi. Aye. Hayashi, aye. Hernandez. Aye. Hernandez, aye. Lowenthal. Aye. Lowenthal, aye. Mansour. No. Mansour, no. Mitchell. Aye. Mitchell, aye. Nastandi. Pan? Aye. Pan, aye. Perez? Aye. Perez, aye. Silva? Smythe? No. Smythe, no. Williams?
Aye.
Williams, aye.
That bill has 13 votes. That passes out. Thank you, Ms. Hayashi.
Thank you very much.
To pass to appropriations. We're going to go next to item 6. AB 715, bill by Ms. Galgiani. She is out sick today, and by prior arrangement, Ashley Medina will be presenting AB 715. And while they work their way up to the podium, for members who got here after we commenced, we did pass the consent calendar, and we did pass the adoption of committee rules, and Mr. Fuentes' bill was passed. When we finish session, you'll have an opportunity to add on to those votes if you so choose. We're now moving to AB 715 by Ms. Galgiani. That'll be followed by our final bill of the day, AB 300 by Ms. Ma. And without further ado, welcome Ms. Medina.
Thank you, Mr. Chair and members. My name is Ashley Medina, and I'd like to thank you for allowing me to present AB 715 on behalf of Assemblymember Galgiani, who is ill today. California Children's Hospitals provide vital services to the most vulnerable Californians, whose needs in this time of economic crisis will only grow. A cut in provider reimbursement directly impacts access to care. Historically, hospitals were reimbursed for non-Medi-Cal CCS patients based on their interim rate or the Medi-Cal allowable cost-based rate, regardless of the hospital's contracting status with the California Medical Assistance Commission, or the CMAC. After a recent legal review of statutes governing the CCS reimbursement, the Department of Health Care Services, DHCS, believed an inadvertent change required hospitals to be reimbursed at their negotiated CMAC rate, and also considering recouping payments from hospitals for an unknown prior period of time. Assemblymember Galgiani also carried Assembly Bill 2474, that was chaptered in 2008, and AB 896, which was chaptered in 2009, which clarified reimbursement for non-Medi-Cal CCS patients and the Genetically Handicapped Persons Program to be 90% of the Medi-Cal hospital interim rate of payment developed by DHCS. However, AB 896 contained a sunset of January 1st, 2011. AB 715 seeks to provide hospitals that provide care to CCS children by clarifying reimbursement for hospital services at 90% of the interim rate. It was never the intent that these high-cost services to seriously ill children be reimbursed at an amount less than the Medi-Cal allowable cost.
Move the bill.
I am pleased to have with me Sharita Lane on behalf of California Children's Hospitals, the sponsor of AB 715, to testify in support and answer any technical questions.
We have a motion by Mr. Smythe, a second by Mr. Amiano. Now we'll hear from witnesses in support.
Mr. Chair and members, Sharita Lane with the California Children's Hospital Association. The number of children enrolled in the California Children's Services Program but not enrolled in Medi-Cal is very small. But unfortunately, their illnesses are quite severe, and their conditions are often quite costly to the hospitals that serve them. As Ms. Medina said, AB 715 would ensure a more adequate reimbursement for these services at historic rates, and this will help ensure access to care for all California children. Currently, children's hospitals are very much struggling to meet the needs of sick and injured children statewide, and so this will ensure our reimbursement is at adequate historic levels to ensure that that is not compromised. Thank you.
Thank you.
Mr. Chair and members, Connie Delgado with the California Hospital Association. We're pleased here to be in support of the bill.
Thank you. Other witnesses in support?
Terry Calgar-Hill on behalf of Children's Hospital and Health Center, Oakland, in support.
Tricia Hunter on behalf of Rady Children's Hospital, San Diego, in support.
Thank you. Other witnesses in support? Witnesses in opposition? Seeing no witnesses in opposition, any member questions? Dr. Pan.
Thank you very much for bringing this bill before us. Just a question regarding the interim rate that Medi-Cal pays, or the Medi-Cal allowable. Is that a cost-based rate, and you're looking for being paid only 90% of a cost-based rate?
That is correct, and it is Medi-Cal allowable cost, which is much lower than actual cost. But yes, that is the intent.
So in other words, what we were voting for is to allow you to only collect 90% on a cost-based Medi-Cal allowable rate, which is going to be better than this SAMAC rate, correct?
Correct.
Thank you.
Any other member questions? Seeing none, I want to thank Ms. Galgiani through your presentation, your very able presentation, for helping us refine this to the benefit of the hospitals that have been identified. I'd ask the clerk to call the roll. This is due pass to appropriations.
Monning?
Aye.
Monning, aye. Logue? Logue, aye. Amiano? Amiano, aye. Atkins? Atkins, aye. Bonilla? Bonilla, aye. Ing? Ing, aye. Garrick? Gordon? Gordon, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Mansour? Mansour, aye. Mitchell? Mitchell, aye. Nastandi? Pan?
Aye.
Pan, aye. Perez? Perez, aye. Silva? Smythe? Smythe, aye. Williams?
Aye.
Williams, aye.
That bill has 16 votes and passes out to appropriations. Thank you very much. Our final presentation today, AB 300 by Ms. Ma. Is Ms. Ma available? I'm going to hold the calendar, the docket open for 5 minutes for Ms. Ma. If some members want to add on to the other bills, please do so in an orderly fashion and let our clerk get one at a time, please.
Yeah.
I think I Go and play.
Sergeants, have we heard anything from Ms. Ma's office? 5 minutes? Yeah, she has 3 minutes.
I know, you should have.
Okay, members, if you take your seats, Ms. Ma has arrived. Thank you for your patience, members. Ms. Ma, AB 300.
Thank you, Mr. Chair, members. I apologize. Thank you, colleagues. AB 300, the Safe Body Act bill, is back again. As you remember, I brought nice, lovely pictures last year for the freshmen who are here. If you'd like to see them, I have them in my office of all of these infected procedures. This state requires that manicurists have 400 hours of training to be licensed, yet tattooists and body piercers do not have even similar levels. Anyway, my eyes pop out too. So I know you moved the bill, so I'm just going to have the speakers present, and then I'll answer questions.
Mr. Chairman, members, Justin Malone on behalf of the local environmental health directors, we the regulators, we're thrilled to bring this bill back to you again. We're one of 4 sponsors of the bill, and I think that indicates the level of collaboration here. We've got the 2 main regulators, ourselves and the health officers, and we've got 2 representatives of the tattoo and body art industry with us to show that this is a really good bill. And I'll pass it on to the practitioners to explain why we really need it.
Thank you. We'll take testimony from one more, and then it'll be add-ons of support.
Thank you, Mr. Chairman and members. My name is Michael Hare, and I have a company here in Sacramento called The Exotic Body. I started in 1990 here in Sacramento, and at that time we went to our local agencies looking for someone to come in and inspect our facility, and they told us point blank they didn't know what to look for. I've worked personally with the County of Sacramento to try to get some kind of regulations in place in order to help protect what I see on a daily basis, which is underage and fly-by-night companies doing damage to people that come into our shop every day. Sacramento County has more tattoo and piercing studios than Starbucks. There are so many people out there doing what I do for a living simply to make a dollar and move on without any care for their clients. On a daily basis, we see people coming in with infected and damaged bodies due to someone not being able to go to where these people got their procedures done and do anything about it. There are several shops in California or in Sacramento County that are not licensed, and there's not much we can do about it. What we are looking for again is someone to say that we need to protect the youth of the state of California, and we need to do it now. Thank you.
Thank you. Other witnesses in support, please, your name and organizational affiliation.
Hi, folks. Thanks for seeing us today. My name is Paul Stoll. I'm the owner of Body Manipulations in San Francisco, California. It's the nation's oldest piercing studio.
I'm sorry to interrupt you. We've had 2 witnesses in support, so your name. Thank you.
Thank you.
Bruce Palmer with the Health Officers Association of California, proud to be a sponsor and supporter of this bill.
Mr. Chairman, members, Tom Riley with the California Academy of Dermatology and Dermatologic Surgery. Support the bill.
Mr. Chairman, members, Mike Knudsen on behalf of StudX Company. We support the bill. Hepatitis is forever.
Mr. Chairman and members, Barry Brokaw on behalf of the California chapters of the American Red Cross in support of the bill.
Betsy Armstrong with the County Health Executives Association in strong support.
Kelly Brooks on behalf of the California State Association of Counties in support.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County, here in support.
Tim Lynch on behalf of the San Bernardino County Board of Supervisors, supporting.
Other witnesses in support? Seeing none, witnesses in opposition.
Move the bill.
We have a motion and a second. We have a question. Mr. Amiano?
Ms. Ma, I want to thank you for your piercing testimony. I'll show you mine if you show me yours.
Thank you. Any other questions? Ms. Fiona, would you like to close? Ms. Ma.
I'll just respectfully ask for your aye vote, and I will take the committee's recommendations, analysis on some of the drafting errors.
Thank you. There's a motion and a second. The authors expressed her willingness to incorporate recommendations from the committee. We're not taking any formal amendments in this hearing, but thank you for that, that overture. And I'll ask the clerk to please call the roll. This is due pass and refer to appropriations.
Monning?
Aye.
Monning, aye. Logue? Logue, aye. Amiano? Amiano, aye. Atkins? Atkins, aye. Bonilla? Ing? Ing, aye. Garrick? Aye. Garrick, aye. Gordon? Gordon, aye. Hayashi? Hayashi, aye. Hernandez?
Aye.
Hernandez, aye. Lowenthal? Mansour? Mitchell?
Aye.
Mitchell, aye. Nastandi? Pan? Aye. Pan, aye. Bonilla, aye. Perez? Silva? Smythe? Aye. Smythe, aye. Williams?
Aye.
Williams, aye.
That bill has 14. It's out. Thank you, Ms. Ma. And that concludes our business. We'll keep the hearing open for another couple of minutes for members to add on, and then we will adjourn.